We bring you a spotlight of the World Pneumonia Day celebration here at Ikorodu area of Lagos State. The effort is to strengthen stronger healthcare system here at Ikorodu area of Lagos State to prevent pneumonia, which is treatable and also preventable. My name is Kikelomo Oduyebo. Welcome to Community Feedback on Lagos Television. Every 12th day of November, it is a global day where the world celebrates the Pneumonia Day. A community sensitization is being held just at this hall behind me. The effort is to ensure that every player within the healthcare system here in Ikorodu work effectively so that no child will die before they reach age 5. Let's take this report from our correspondents.
Recently, world leaders gathered for COP27 climate change summit in Egypt, and one of the agenda was to end air pollution and other climate emergency crises by 2030. Air pollution also affects children. Almost a third of all pneumonia deaths across the globe are caused by air pollution. So, the climate crisis is a child rights crisis and poses a serious threat to children's health and well-being. Other factors which cause pneumonia in children resulting to death includes shortness of breath, heavy coughing, bacteria, virus, and fungi. Over 700,000 children under the age of 5 died globally in 2019 as a result of pneumonia, even as medical experts advocate for more vaccination of children against this child killer disease, as well as good nutrition and breastfeeding of newborns. Therefore, the theme for this year's World Pneumonia Day is championing the fight to stop pneumonia. This reminds everyone on the urgent need to take action to protect at least one child from dying globally every 45 seconds as a result of pneumonia. Here in Ikorodu area of Lagos State, this community sensitization to community health workers, Apex nurses, World Health Committee members, Ikorodu Health Authority workers, religious and community leaders is to seek better ways of strengthening the healthcare system through their collaboration to stop pneumonia from killing children under age 5.
One thing about this pneumonia is that it's a vaccine preventable disease. I mean, there are vaccines that can be used to prevent it, and it is available in the routine immunization schedule of the children. Then what the government has done to actually, actually prevent this infection is that, one, we have vaccines are available at the health centers for these children, and they are free of charge. Also, in management of this vaccine, of this infection, sometimes you may need to give oxygen, because during the infection, the oxygen level of the getting to the lungs will have decreased. So the system, the children has assisted us with oxygen concentrator that we can use when we have these cases at the health center.
Since pneumonia is both preventable and treatable, these stakeholders were urged to go into the communities, educating mothers and pregnant women on the need for adequate vaccination during pregnancy and for children at the primary health care centers, as well as give children good nutrition and practice hand washing regularly. This comes as the Lagos State government continues collaboration with partners to step up action in the fight against childhood pneumonia in Lagos.
Pneumonia, killer disease, contagious disease, are always the preoccupation of the health authority, Ministry of Health, Ministry of Basic Health Care Board, and things like that. They make the provision and everything. But basically, the health facility is being monitored, taken care, sponsored by the local government. But we have a system body, like the Basic Care Provision Fund from the federal government, and then there's another fund from the state government through the WHCs. So there's a lot of funds coming in. But once we have all these risk factor diseases like pneumonia, HIV, and things like that, the programs are normally being drawn from the states.
For the organizers of this stakeholders sensitization to mark the year 2022 World Pneumonia Day, Save the Children International in Nigeria, the advocacy is for the Nigerian government and partners to champion the fight against childhood pneumonia through improvement in basic healthcare services at public hospitals, including access to oxygen treatment at the primary healthcare level to tackle pneumonia and save the lives of newborn and children under 5 years of age.
We have strengthened the capacity of healthcare workers. We have supported with all the equipment and materials they need to be able to put those trainings into use. And also we are working with the community to be aware of all the signs and symptoms of pneumonia, how to prevent pneumonia, how to respond to pneumonia, and how to prevent children from dying from pneumonia. That is the takeaway from here today. And most importantly, we have also called on the government on what they need to do. That the local government, they have not really been very proactive in supporting primary health care. So we are calling on them that for this, our project to be sustainable, the government must begin to spend money to make sure that IPC materials are available regularly in the health facilities, to make sure that all the support that are needed in health facilities are provided at the primary health care level. We also discussed the issue of the Basic Health Care Provision Fund. We have also worked with the state government to make sure that the people are aware, the community is aware, and also that there is transparency and accountability in the way the money is used. We have also called on the World Health Committee members that they should perform their role in monitoring the way the money is spent.
A donation of hospital equipment worth 23 million naira was made by Save the Children International in Nigeria to be distributed to 5 primary health care centers in Ikorodu to further strengthen prevention and treatment of pneumonia, an effort which complements intervention started since 2001.
Apart from celebrating the World Pneumonia Day, we're also donating hospital equipment to 5 flagship health facilities in Ikorodu, and we are supporting with infection prevention and control materials that will be distributed to all the 30 PACs in Ikorodu.
High point of the community sensitization in Ikorodu was a one-on-one engagement of participants by the officials of the Lagos State Health Management Agency, LASHMA, on the state's health insurance scheme, tagged Ilera Iko, for their buy-in to reduce out-of-pocket expenses on Medicare. The officials of LASHMA say individual monthly package plan costs 8,500 naira per year, while the family package plan costs 40,000 for enrollee up to 6 family members whose health benefits include general consultation, management of chronic diseases, care of newborns, and immunization, among others. With more enrollment of everyone into the Lagos State Health Insurance Scheme, more funding of primary health care centers, and the implementation of the National Pneumonia Control Strategy by the federal and state ministries of health, Nigeria may be on our way towards achieving Sustainable Development Goal 3 on good health and well-being by 2030. Currently, Nigeria is still below 50% of the required rate for SDG 3.
It's now time for our Vox Pop segment. In this segment, we shall be sampling the opinion of Ikorodu community people on how they have been managing the issue of sensitization to the community when it comes to prevention of pneumonia, especially as it affects nursing mothers and pregnant women. But I must say that from the feelers I have heard, the issue of sensitization, especially in the area where they have to patronize traditional-based organization, is still a challenge. But the government is still trying to overcome that. Let's take their views.
I take all my immunization well, and I'm breastfeeding my child.
What we normally tell them is prompt referral. That is, immediately you see anybody complaining of cough or other thing, refer them to the health center to see the doctor.
They see any symptom about pneumonia, they should go to the nearest PAC. And we, as a community man, we are trying to go into the community where people are doing meetings. We are telling them this is what they are supposed to do all the time when they see any symptom. Personally, I go to all my ward to be telling them, going to the Babalawo or herbalist is not good, especially pregnant women. We are telling them, we are advising them all the time.
Today brought to you from Ikorodu area of Lagos State. Remember that pneumonia is preventable and treatable if we expose children under age 5 to vaccination. And of course, nursing mothers and pregnant women must ensure they get all their vaccinations during pregnancy, antenatal care especially. Also, we must make sure we take adequate nutrition for children, wash hands regularly, and expose ourselves to basic health care in primary health care centers, including provision of oxygen whenever any child breaks down of pneumonia or any adult breaks down of pneumonia. Thank you for watching the program today. Stay safe and see you next time.
This is Lagos, you know we love it. This is Lagos.